Medical receptionist interview questions and answers. Landing an interview is the first step to getting your dream job. When you finally get that call, you know it's time to step up and get that job. Interview questions can leave you speechless when you do know what to say. However, answering the questions as expected will win the panelists' hearts and earn you a great job. Here are 20 medical receptionist interview questions and answers to help you ace your following interview. 1. Why do you think you make a great medical receptionist? I have excellent organizational skills and I can manage multiple tasks. I am passionate about my work and stay focused on my schedule. Additionally, I understand that most patients seeking my help need a listening partner and exceptional service. Dealing with people face-to-face requires empathy and care. I also blend in easily with any medical team and ensure that all my duties are done professionally. 2. Tell us about yourself. My name is Jane Doe. I possess a college diploma in medical office technology. After graduating from college, I joined the XYZ company, where I have been working. During my 3-year stay at the company, I learned helpful job skills. In my role, I have supported the medical team while serving them and their clientele. 3. What are your strengths? As a medical receptionist, I realized one of my strengths is my communication skills. Communication is one of the crucial skills that a good receptionist must possess. I talk to patients who may be in a foul mood or have panicked and relay the necessary information. That also helps me relate well with the medical team. 4. How do you plan to motivate yourself? One of the ways I keep motivated is by creating a schedule for my work. I am passionate about my work and give my full potential to every task. I also like finding and implementing new ideas that can help improve working conditions. 5. What are your weaknesses? One of my weaknesses is that I get bored quickly with routines. Schedules sometimes give me anxiety, and I tend to forget what goes where. To solve this, I work closely with technology to help me make schedules and set reminders to keep up with my plans. Google to-do lists are a simple way to keep track of everything I need to handle daily. 6. What do you picture as a typical day as a medical receptionist? A medical receptionist works at the front desk to ensure harmony between the medical staff and patients. The receptionist welcomes patients, gives them valuable information, books meetings, and collects customer payments. They oversee scheduling customers and even call clients who may need to remember their consultations. 7. Why did you apply for this job? I have always wanted to work with a company like ABC. With my skills and experience, I can effectively contribute to the establishment's growth. Its reputation for offering professional skill-based training and favorable working conditions also caught my attention. It would be an honor to be a part of the great team. 8. Why do you want to leave your current position? I have always wanted to move to this location. I enjoy the warm weather here and do not have to drive too far to work every morning. Long drives to work interfere with my productivity. Therefore, I can utilize the time I use to commute to work and focus on my work. 9. How do you handle busy days at work? On busy days, there are many patients on the line. I create a schedule based on the order of urgency. Urgent tasks are my focus, while the rest I handle after. Sometimes I need help dealing with some situations. I can involve a colleague to help me carry out some tasks while I deal with the rest. 10. What is your working pace? I have developed a steady working pace in my 3-year stay at XYZ. I set milestones and goals to keep me focused on my work. Avoiding last-minute pressure ensures that I pay attention to detail and carry out all my duties as required. Moreover, organizing my work in sections ensures that my colleagues stay motivated and keep up with my work pace. 11. Describe a time when you multitask. I have had a scenario like answering a critical call, responding to a doctor, and receiving a patient for their appointment happen at once. When this occurs, I ensure that I pay attention to detail and handle everything with composure. I maintain a professional demeanor even when everything is spiraling out of control. Knowing what each person demands helps me deal with each accordingly. 12. How do you cope with change? Whenever I take on a new task or challenge, I anticipate change. New roles come with new responsibilities. As such, I take note of the changes that happen. Consequently, I developed a new schedule to accommodate any changes to my daily routine. 13. What medical reception tools and applications? Have you worked with at your current position? I rely heavily on running an Excel spreadsheet to enter any details I need for record keeping. The spreadsheet is a simple way to track patients, their schedules, and billing information. Web-based accounting software is also helpful for handling billing. I also respond to the patient's emails and update social media pages for the organization. 14. How do you deliver an unpopular opinion or bad news? When I relay sad news, I ensure that the patient is calm. Take heed of their feelings and emotions and draw their attention to facts. Additionally, it is crucial to use sensitive language that shows empathy with the person. 15. Describe a time when you had a conflict with a patient. While working at XYZ, a client came in a day after their appointment. According to the schedule, it was clear that the patient was to check in the next day. However, the patient was not willing to let the matter go. I devised a way to calm the patient down and convince them to return tomorrow. 16. What challenges do you expect to encounter? While doing this job, one of the challenges this role will encounter at this job is longer working hours. The hospital is busier than in my current workplace. I have planned how to reorganize my schedule to help me cope with more work. 17. Are you comfortable making debt collection calls? In my previous job, I would call patients about debt collection. When dealing with such cases, I show empathy to the client. I have even had to lead the patients in problem solving to help them get the finances to pay off their debt. 18. How do you deal with people? When you have a bad day. We all have bad days, but they should never stop us from doing our work. I ensure that personal issues do not stand in the way of my work. I always greet customers with a bright smile and welcome them to the organization. 19. Where do you see yourself in the next 5 years? I work as a medical office manager. I also want to take more courses to help me acquire more skills and training. The job offer will allow me to prove my skills and expertise. 20. Do you have any questions for us? I would like to know what the immediate priorities for this position are. I also would like to find out the performance and output measures for this job. My last question is how long the recruiting process takes. Acing an interview can be challenging. Luckily, 20 medical receptionist interview questions and answers can help you get your dream job. Go through them and practice before your interview, and you will get that job.